Good evening, ladies and gentlemen. It's 7 o'clock, so we'll make a start with tonight's meeting. Before I begin, I'm going to read out the webcasting introduction. I would like to remind everyone present that this meeting will be recorded live and will be capable of repeated viewing or other such use by third parties. Therefore, by entering the council chamber and using the seating area, you are consenting to being filmed and to the possible use of those images and sound recordings for webcasting and/or training purposes. Good evening, members. My name is Councillor Aniket Patel, and I will be chairing tonight's meeting of Community Scrutiny Committee. On my right, I have Councillor Jodie Lucas, who is my Vice Chairman, and on her right, I have Laura Kierman, who's our Democratic Services Officer, and on my left, I have Jill Wallace, who is the Service Director for Customer and Communities. Laura, do we have any apologies for absence, please?
There are several apologies for absence. We've received apologies from Councillor Joggia, Caroline Pond, Stephen Murray, Craig McCann, who may be able to attend virtually, Maria Markham, Shane Yarrell, Razia Sharif and Rose Brooks.
Thank you. And do we have any substitute members, please?
There are some substitute members here tonight. Councillor Mead for Councillor Brooks, Councillor Allgood for Councillor Pond and Councillor Whitehouse for Councillor Sharif.
Thank you.
We are quorate, Chairman.
Thank you. Do we have any declarations of interest on items on tonight's agenda? I think I should declare that I am, for item number 8, I am the Chairman for the Health and Wellbeing Board for Epping Forest. So item 5 this evening is notes of the previous meetings, which is listed on pages 3 to 7. Do we have any comments on those, members? So can I take them as agreed, please?
Agreed.
Thank you. Item 6 is the work programme as listed on pages 8 to 10. Do we have any comments on the work programme? No? I think we can note that we've made really good progress this civic year. This is the last official meeting of the Community's Scrutiny Committee, although we have an extraordinary meeting scheduled for a couple of weeks' time. And we've managed to get through most of the council business for this committee. So I'll take that as noted then, please.
No.
Thank you. Item 7 this evening is the Housing Asset Management Strategy update. I'm going to hand over to John Tapas, who's the Interim Head of Asset Management, to lead us through this report. Thank you.
Thank you, Chair. I've got a very short presentation. Let me just find it here. Well, that's good. Yeah, so this is an update on the housing asset management strategy. You might be aware that we commissioned Art Consultancy to help us, not do it for us, but to help us prepare a strategy to bring our asset management of our housing to the level, to make a step change in the level of performance of our asset management. So the progress so far, the research has been completed, and that research included a stock tour, a survey of tenants, which I'll tell you a little bit more about in the next slide. We had focus groups of staff. We had benchmarking, so comparing our figures with our costs and performance with others, and then a series of one-to-one interviews with key members of staff. And from that, all those findings have been put into a position statement and then turned into the draft outline strategy, which is included in your papers. So I'm just going to pick out some key points of the strategy. I know it's a long document, but if I pick out the key points, it may help. So the first one was we ran an online survey of our tenants on what their priorities are for housing asset management in Epping Forest District Council. We needed to get about 300 responses to get a decent confidence level in the findings, we actually got about 540 responses. So a fantastic response, which really helps. It means that we can really rely on those as being a true indicator of what the priorities are. So they asked a series of questions, and one of the questions towards the end was, of all the priorities that you've listed, which 3 are your top ones? And they had to select which the 3 were. And you can see from those bars, there were 4 that came out ahead of most of the others. And the top one was getting repairs done. Then it was about safety in the home. And then it was about facilities in the home, your kitchen and bathroom, and energy use in the home. There were other priorities too, including outside the home and those others there which are included. The document that you have in your pack has condensed this down to 7 strategic priorities. The first one, stronger voices, and this means working hard to understand the needs and expectations of our tenants and leaseholders so that we can respond to that. The next one is about developing a better understanding of our stock through our data collection and analysis so that we can make the best decisions for our tenants and leaseholders and the best decisions for the council as a business, if you like. The next one is improving the standard and performance of our repairs and maintenance service. Then there's a priority about targeting investment to improve the quality of the homes that we provide. Then there's one called Stronger Places, which is about working with partners to improve our neighbourhoods and create places where people can thrive. So that's about transport links and other parts of infrastructure. Then a priority about getting better value for money in the delivery of the investment and the services we commission. And the final priority is to review our team structure and improve the effectiveness of us acting as a good client and working effectively with other teams. Finally, there was just one slight amendment that was made since the strategy was published to you, and that is on page 12 in the green box. There was this makes it clearer. This is about the service level agreement we would like to develop with Qualis, and the amendment makes it clearer that we want to work towards top quartile performance, which is a very high level. We're a long way from it now, and it's going to take a while to get there. So I think the previous version kind of suggested that we would get there straight away, but it's about making sure that we have continuous improvement year on year. We get better and better, and we provide that at a cost that represents value for money. Right, thank you.
Thank you for the update, John. Members, before I hand over to you, I think it's important to bear in mind that we have to consider and comment on this draft cabinet report. So, do we have any comments? No. Councillor Whitehouse?
I didn't quite catch what you said. Are we commenting on this report now, or did you say later?
No, now.
Right. Yes, I do have a couple of comments. Generally, it was a good report. I enjoyed reading it. But I'm a bit confused as to the responsibility of the council that's doing this asset management report, and you're the interim manager of it. And yet I thought we'd passed it over to Qualis. So somewhere in the report it talks about the council's asset management, whereas I thought it was all gone. So I'm not quite sure whether we're talking about things Qualis are doing or the council's doing. I've got a couple of sort of more specific things. On page 19, it's one about key facts. I was surprised that the report's got as far as coming to us without the number of how many leasehold homes we've got. It's still got a query against that. And the last paragraph is very sort of aspirational, but I would have thought we could have figures as to how many right-to-buy houses we've sold and how many we've replaced, because, you know, it's not a key fact without that information. So I think that needs to be put in before it goes on to Cabinet. But page 26, in the green box there, it's about our actions for delivering stronger places. And paragraph 2 talks about working actively with colleagues to provide new affordable homes by increasing density. I'd really like a bit more information about who makes that decision and what density you're thinking of. And then it talks about served by transport, leisure, health and other infrastructure to meet residents' needs. So easy to say that, but as someone who's tried to get transport improvements, it's so difficult, and infrastructure as well. So I'd really like to know what the how is. How will you do that? Because, you know, it may be long term, but, you know, it's so easy to say but not to do. So, yes, I thought it was a very interesting report, but just got those few queries. Thank you.
Thank you, Councillor Whitehouse. Mr Tapas.
Thank you. Thank you. Yes. So this is an outline strategy. The detailed one is being developed, and we can make sure that we get some of those figures in, like the number of right-to-buys and so on. And the transport and infrastructure issue, I don't think we're going to have the answers in the strategy. All we can really say is that we will support any improvements to that structure. I think that's an area of the strategy that we can influence, but perhaps not control. But we can lobby and or we can facilitate or do whatever we can to make that happen. Increase in density. Well, there is a desperate need for more housing, and sometimes denser housing works better than very dispersed housing. You get that critical mass of people and expenditure, so it helps local shops thrive and local businesses work because there's more people spending money in that area. So density can be a good thing economically. And so, your first question is about whether it's Qualis or the council. It's actually a partnership, but we really need to be very clear about our respective roles. And as a council, our role is to plan what we need to do, to commission that really clearly in very clear briefs, and to monitor its delivery. And Qualis will deliver, and we will monitor how well they deliver. So it's a partnership, but it needs to be really clear what our respective roles are. You're quite right.
Thank you, Mr Tapas. Councillor Phillip.
Yeah, just wanted to perhaps help the council a little bit. The standard asset management, so our commercial asset property, that's what we are transferring across to Qualis. The housing asset management, the responsibility for that remains in-house. So that's where the separation comes. But I think that's possibly also where the confusion can arise.
Thank you. And I've got, just before I come to Councillor Allgood and Councillor Mead, Mr Ballard, did you want to come in on the questions that Councillor Whitehouse has asked?
Yes, please, Chair, if I may.
Please do.
Yeah, I think Councillor Whitehouse, yes, certainly some good points there. Just in relation to the numbers, certainly I think it's just a version control item. So we do have 200 affordable homes and just over 1,000 leasehold properties. So I think it's just the version that's before yourselves today. So we'll certainly make sure that an updated version of that position statement gets circulated with the notes. Thank you. Thank you, Chair.
Thank you. Councillor Allgood.
Yes, thank you, Chair. Thank you for the report. I appreciate it. It's a strategic document, so probably my question might be a bit more hands-on, but I still have to explain to people who see, let's say, every single roof being replaced on every single council property, even though the roofs are intact and appear good. Likewise, every single set of double glazing windows that goes in, they see a new set that's only been in there a few years or appears to be in there, and they will always ask me, go, surely we shouldn't be replacing stuff at this time. So my question is, whilst it is a strategic document, there's no explanation of why we just do a block maintenance. I appreciate that might be to bring them all up to standard, but I don't think we're telling the public why we do that, or if there's a better way of doing it, waiting for it to be in need of repair rather than just replacing it on block, if that's okay. Thank you.
Okay, yeah, you're quite right to point that out because that's the important part of the bit about managing the data and that performance, because the ideal time to replace a roof is the day before it leaks. And so we have stock condition surveys that give an estimate of how much life a roof has. So they might estimate it's got 10 years life. But that is really difficult to do just by sight. So what that happens, that we've set a budget aside in 10 years' time to replace that roof. But before we replace that roof, we go and check it again to see whether it has another 5 or 10 years. If it does, then what we should be doing is delaying that replacement for 5 or 10 years. So we need to get better at that. So absolutely, we don't want to replacing things too early, because that's not a good use of money.
Thank you. I've got Councillor Mead next, and then Councillor McCann, and then Mr Marshall.
Yeah, thank you. I was just reading at the top of, on your report there at the end of it, it mentioned you want to get to top performance. So I'm just, but you're a long way from it. So I'm just wondering why is that, and what you see as top performance? What do you feel that you need to do to get there?
Yeah, very good question. So we know top performance because we've joined a club called Housemark, and they have standard key performance indicators, and they take data in from all over the country, and we can compare ourselves with all of those, or a subset of those, maybe other housing providers of the similar size in this part of the country. And they divide it into quartiles, and to see where we are. Now, we're variable, some we're higher, some we're lower. But what we need to do is work together with that performance data to make those kind of marginal gains each time. Just look for something that we can do better. And then over time, our performance will improve. But it takes us as a council and the Qualis to go through that information. It goes back to the stronger voices as well, getting the information from the tenants, but particularly the tenant satisfaction surveys and the comments that are provided, are really rich information about things that they liked or they didn't like about the way the service was delivered. And then from that, we can take that, do a toolbox talk to the operatives about you need to do it this way, you need to cover your shoes, or whatever it is that's come up. And then bit by bit, we can improve our performance. It does take a long time, but it also means it needs a good attitude and a good attention to detail, and giving that priority, because we need to spend time on that every month to go through all those comments and those figures.
Thank you. Councillor McCann.
Thank you, Chair. Again, apologies, I can't be here this evening. Just a few points. Yeah, really enjoyed reading the document. Page 3, middle of you've got our arrangements with Qualis Group. You referred to be succeed, should be to be successful, a minor point. I think Councillor Whitehouse has already raised on page 4. Key facts about our homes. You need some figures in there in the first paragraph. On page 4 at the bottom, it says we spend about 2.8 million a year on revenue works in preparing properties for re-letting. You've got a figure above that, around 2.2 million, carrying out servicing and checks for heating, electrical, etc., etc. So it'd be good to get a sense as to what that 2.8 million consists of in terms of preparing properties. Was that in between lettings? So is that what is that made of? It seems a lot of money in between lettings that's outside of the servicing cost at 2.2 million. So it'd be good to get some clarity on that. I think on page 7, you've got a pie chart there. There's no. I think above that it mentions it's not consumer standards there. I looked that up, so it'd be good to get a sense as to what that pie chart relates to. It could do with maybe just a descriptor underneath it. And then later on, appreciate I'm zipping through the document here. Page 10, you refer to setting up a future homes group. How is that going to be different from the strategic asset management group that you refer to on page 8? It'd be good to get a sense of what the difference is between the two. And then I think the last point from me is on page 11, where it's in the green box, says use our place in the Epping Forest Community Safety Partnership, CSP, community groups to deal with emerging local threats and issues. There wasn't, I don't think, enough of an emphasis on that page 11, on the action taken around antisocial behaviour by individuals. So I wonder if that could be revisited, because it seems to be quite vague at the moment. So if we're talking about people who are tenants, are there any opportunities or any work to be done around reinforcing terms and conditions, and people who are committing or crime generators and antisocial behaviour, obviously causing a blight on people living within these addresses. So just a point around that, and I think that was it from me. Thank you. Appreciate there's a few different points there.
Thank you, Councillor McCann. I hope you made a note, Mr. Taphouse.
Yeah, some of those are definitely typos, and we'll definitely make sure that those are corrected, and maybe caption the pie chart. We'll certainly do that. So that 2.8 million between lettings, we call that those void repairs. So it's the repairs between when a tenant leaves and we need and you go into property and the repairs need to bring it up to the standard. We have a void relet standard that we need to get it to before we relet it. So we need to work at bringing that cost down, and there are several ways of doing that. One of them is having fewer voids, so that means having our tenants stay in the homes for longer, so the turnover is lower. That will reduce the number. And then we need to reduce the amount of repair in there, so that's more working with the tenant during their tenancy, but particularly when they hand in their notice to say, we're handing our notice, we want to move, and working with them to make sure that they leave the home in a good condition. So I think that is a real priority for us to bring that down and work on that one. The Future Homes Group is really about setting those standards. So I talked about that void relet standard, so getting that right. I mean, one debate we're having is, should we provide floor coverings, carpets and so on in homes? In Wales, it's mandatory now. It just came into law last year that we should do that. And there might be arguments for it. It might cost more now, but it might mean that it gets the tenancy off to a good start and they might stay longer. I don't really know. I think there needs to be a bit of research there and see what's being done. But we need to have those discussions about what our void stands be, and that will be what the Future Homes Group would be discussing. And also about what specification of components we put in, because we want to put in components that are going to be durable, last and be functional, rather than the cheapest component we can find. So we want to make sure we get value for money, and that might mean spending more money on the component up front. And on the antisocial behaviour issue, that is a very wide issue, and what in the document you might see something about assessing property performance. And when we mean, and what we mean by that is there are really two dimensions to this. One is financially. Does it make a surplus or does it make a loss, depending on the rent coming in and the maintenance and repairs and management costs going out? But also, how does it perform socially? So is it a place where people want to live in the first place, and then when they're there, do they want to stay there? So how does it perform in that sense? And then what can we do to make it perform better? What can we do to make people want to live there in the first place, and once they're there to stay there? The answer isn't always an asset management thing. It's not just a bricks and mortar thing. It can be a management thing. It can be other initiatives. But we want to make so this asset management strategy does need to go over and work with people in our housing team as well. Have I covered everything?
I think those were all of the questions that were asked by Councillor McCann. But you satisfied with the response, Councillor McCann?
Just to follow up on a couple of bits. Thank you, Chair. I suppose the question was really around on the Future Homes Group. How is that different from the Strategic Asset Management Group? Just if you could explain that to me. How are they sufficiently different to have to exist in two different entities? And I suppose the other thing was around, the 2.8 million, just going back to that. Are there any, what are the sanctions in place when you kind of go back to the antisocial behaviour point, to which it's linked? Do we follow up and take any sanctions or remedial actions with individuals who have effectively, there'd be very few instances of this, I appreciate, but there's quite a lot of money involved in this, but who have criminally damaged property that then has to be fixed before it can be re-let. So do we proactively take action against individuals in those circumstances? Just those two follow-ups, please, Chair.
Thank you. I've got Mr. Ballu wishing to respond. Do you want to come in?
Yes, thank you, Chair. And Councillor, if I may just probably come on those 2 points. I think a key difference between the two groups is going to be, one is a very strategic group, and the Future Homes group is going to be more of an operational group. What can be done tactically on the ground? And one of those there might be items or measures that we can put in place that might be piloting, for example, or something that we might want to test out. So I think one is an operational approach and one is very strategic, the likes of which that I would normally get involved in terms of what sort of future planning look like around either around voids, it might be around budget, it might be around service level agreements, for example. So they're going to be the two key differences. And it probably goes back to one of the points that Councillor Whitehurst made earlier in terms of the accountability still resting with the council and the delivery function then being delivered through quality. So one is a very operational piece and one is quite strategic. So that'll be one key part of that, and I'm always happy to have that conversation offline should you wish. On the other point, in terms of ASB, social behaviour, should I say, yes, you're right. I mean, when we do have deliberate damage that's been sort of taken or sort of inflicted on property by our residents, we do look to enforce sort of tenancy agreements, tenancy action against those households, and if we're able to recover costs of damage to property, certainly we would look to pursue that. And there are routes and avenues that have always been available, and it's whether we can strengthen that sort of that piece of work going forward. And probably linking into the voids piece that you mentioned, I think one of the areas of work that we're looking at to try and have properties returned to us in a better state is what can we do around that sort of pre-void state. So before someone returns the keys to us, what work do we do with that household? Are we able to get in there, have a look, inspect the properties? Are we able to encourage people to stay perhaps? Or if there is damage to a property, the efforts that we make then for tenants to make good the damage before they move on, or what we then do to sort of say, look, actually, this is the level of damage and the cost of damage, and do we then consider something around a charge to a tenant? So they're going to be areas that we can look to strengthen our sort of position going forward, and then in turn, that should sort of reduce the amount of cost that the council then bears in terms of repairing properties to make them fit and ready for a future tenant. So hopefully that addresses those sort of two key points. Thank you.
Yeah, no, thank you very much indeed. That does address both points, and it's welcome news to me that to my ears that you're looking at strengthening some of those arrangements because that 2.8 million is a lot of money outside of the 2.2 million service costs. So thank you very much.
Thank you. Got Mr. Marshall.
The strategy was brought before the Tenants Leaseholders panel. We were under the impression this is just an overall strategy and it wasn't going into too many specifics, because specifics will change year by year. For example, you could say how many houses or properties were sold this year for right to buy, but that will change next year. So I don't think you can put those figures in, or that's the impression I get anyway. There wasn't too many specifics. In terms of voids, don't forget that the council is obliged to meet the decent home standards. So it doesn't matter what state the houses or the properties are in, the council is obliged to meet those standards, and those standards are about to be improved and highlighted even more in the future. So I can understand why councils are asking specifics, but I'm wondering how many specifics can be put into an overall strategy.
Who wants to take that? Mr. Taphouse.
You're absolutely right. I mean, it needs, the strategy kind of works out where we are now and where we want to be in this case, five years' time. But it does need to be in broad terms because things change. So, and right to buys in particular, we don't really have much control over because so we can't really include it in our strategy because there's not much we can do. But yeah, so I think you're right. It does need to be general. It does say where we are and roughly where we want to get to, what we need to improve on, rather than exactly in figures what we need to achieve in most cases.
Thank you. Mr. Balu?
Thank you, and thank you, Will, for that point. If I can just sort of mention that within the position statement, and this is an overarching summary position statement, the strategy will aim for an annual delivery plan, and in that we will set out key actions that are going to be deliverables each year, and then we would look with our consultants to review the strategy position and document each year annually over the next 5 years as well. So there'll be milestone reviews on an annual basis, and a resetting of the annual delivery plan against the strategy to make sure that we've got measures in place, milestones in place, actions in place, and that we can then actually monitor our performance and our achievements against the strategy as well. So that's where we will have a bit more flesh on the bones, as you know, for want of a better expression, around what will we actually look to sort of deliver, in small chunks each year. Thank you.
Thank you. Councillor Lucas.
Thank you, Chairman, and thank you for your report and to the ARC for their assistance with the strategy so far. Considering they was only appointed in October 2023, it's something that has been pulled together and is something that is important that we deal with quite quickly and get this strategy started to be actioned. That brings me to my point with regards to the action plan. I think it will be important for us at Scrutiny to have visibility of the action plan as soon as it's available, so that can come back for us to review. And also with regards to the 12 monthly reviews, I was just listening to what the officer was just saying about how they're going to be reviewed on a 12 monthly basis, but I'll be interested to see the benchmark of exactly how we're going to review the success of the implementation of the strategy through the action plan. I think as a strategy document, when basically hit the nail on the head, we probably shouldn't go into the details of the specifics, but we will have the more detailed asset management strategy that, again, I think is important that we have visibility of, so that we can make sure that we are within that, hitting all of the points of the overall strategy. I think that the couple of typos and errors have been picked up, so I think that that can easily be addressed. I just had one small question with regards to the position statement, and that was just with regards to when you started your report, you mentioned that there was some priorities that had been considered, and I just wanted to know when it came to repairs, safety, energy, etc. Was they kind of a generic multiple choice, or was they just kind of people could write in their own priorities? And also with the 540 responses, how did we actually receive those responses? Was this something that we wrote out to our residents, or was it online, or etc.? But thank you.
Thank you. Mr. Taphouse.
Yes, thank you. Yeah, it was online. We have email addresses for most of our tenants, and they're representative in all age groups except the very over 70s, I think, and many of those live in our independent living units, so we made an extra effort to knock on doors and get responses from the over 70s age band. But it was a multiple choice, so it would ask a question, for example, getting repairs done, and score it on a scale from 1 to 5, from not important to extremely important, and they would score 1, 2, 3, 4, or 5. Now, many people just put everything at 5 or 4 or 5, and that's why we had that question at the end. Of all those priorities, if you were going to select 3, which 3 would you select? And that's why I think that last graph is probably the most informative one, because they were forced to choose the top 3. But there was a chance, there also some free text as well for people to give us comments. So we've been through those. A lot of them were individual ones asking for repairs to be done, so we've ordered those repairs. But some of them gave us some useful comments as well.
Thank you. Do you want to come back, Councillor Lucas?
Thank you, and I appreciate those. That was just a small part, but I just wanted to make it quite clear my point with regards to the action plan. I would just really request that once we've got the action plan, that does come probably back to this committee.
I think that's a sensible way forward. Members, you in agreement? Yep. Okay, that's fine. Thank you. Councillor Allgood, do you want to come back with?
Yes, thank you. I've read the document and I haven't seen anywhere, and forgive me if it comes under partners, but the actual private leaseholders that are part of quite a lot of our properties that obviously share ownership with the council, shall we say. There's no reference to them, unless I'm mistaken, and that's actually quite a big part that we need to be including in our report. If you've got any comments on that, thank you.
Yes, of course. I do. I mean, most of our repairs are within people's homes and their tenants, but the repairs to the common parts and also the planned works that we do, particularly the ones that are rechargeable, then that will an important part. So we'll make sure that the final report covers that off as well. But the value for money and the quality of the work are going to be central to this, and that's absolutely. We'll make sure that's included in the detailed report.
Brilliant, thank you. I've got Mr. Baloo who wants to come in. Just.
Yes,
sorry, Mr. Baloo. Councillor Allgood wanted to come back.
Yeah, so I'm fine with that, but for instance, I've got a gentleman who wants to replace his windows, but can't because the council have a plan of when they want to replace them, and they won't, even though he's quite willing to buy new windows, they won't let him because it has to be done by the same company, and they haven't decided who the company's doing it and what style it's going to be. So again, in a strategic, we're missing a whole load of points where I appreciate that's an individual case, etc., but there are other ones where people want the door securities and things like that and can't do it. So as a strategic, we need to be saying we need to be listening to the other people who are the leaseholders and working with them, because I don't think this document covers that anywhere else. Thank you.
Thank you. Okay, so I can't see. Oh, sorry, Mr. Baloo. Did you want to come follow up on that?
Yeah. Yes, please. Thank you, Chair. I think it's just to sort of draw out the important differences and obligations between tenanted and rented stock and leaseholder stock. So certainly, John, I think, made reference to sort of communal areas. It might be sort of leaseholders within blocks, so therefore things like communal areas, doors, roofs, etc., may need some replacement in a planned way. But I think there are differences in terms of the inside of people's homes. Whether it's a leasehold property or whether it's actually a tenanted property. So that's just a key difference that I would sort of need to point out. And the other piece really is around, looking at cases on an individual basis. If there are ways in which we can work with our sort of households, then absolutely. But I think it does depend on each case by case on an individual basis, whether we're able to look at replacements on an ad hoc basis, but certainly we're happy to have a look at those. But we would normally look at our planned programmes to sort of look at our best sort of economies of scale, value for money, and making sure that we can leverage the best out of our contracts as well. So it's just a reference point more than anything else.
Thank you. So members, we've discussed the paper, the update at length, made asked a number of questions and made a number of comments. Cabinet members were here too, that are in attendance, have heard what we've said, and Laura's made notes of all of the points that have been made, so we'll make sure that this filtered back to the next Cabinet meeting. So thank you very much, Mr. Tapas. So the next item on tonight's agenda is the Epping Forest Health and Wellbeing Strategy as listed on pages 30 to 46, and we have Fabrizio Ferrari, who's our Public Health Improvement Officer, who's going to lead us through that report. But I'd like to welcome to the Chamber this evening, we have Rachel Lewis, who represents the Essex County Council on Active Essex, and we have Joe O'Boyle, who represents Citizens Advice Bureau. Thank you for making the time this evening to come and present.
Thank you, Chair. So I'm Fabrizio Ferrari. I'm the Public Health Officer at Epping Forest District Council and also the Team Manager for Health Improvement and our Economic Development team. I'll allow Rachel and Joe to introduce themselves as well, just to give a bit of a brief, bit more in-depth summary into that.
Good evening, everybody. My name is Rachel Lewis. I'm the Relationship Manager for Active Essex and the Chair for the Healthy Behaviours Subgroup, which sits underneath the strategy.
And I'm Joe Boyle, and I'm Chief Executive at Epping Forest Citizens Advice, and also chair the subgroup on socio-economic under the Wellbeing Strategy.
Thank you both. So today we're here to present on the progress of the multi-agency Epping Forest Health and Wellbeing Strategy. The strategy is a partnership strategy that sets out the health and wellbeing priorities for our district as agreed via a community and stakeholder consultation. The strategy was launched in 2002 and goes through to 2026. So the strategy is working to address 5 key priorities that were identified via data and consultation with our partners and community. The first one is to improve mental health and well-being. The second is to reduce loneliness and social isolation. Third is to improve physical activity and also in that support healthy weight and a healthy lifestyle. We then have to support residents with the rising cost of living. And finally, to tackle alcohol and substance misuse. Those priorities are delivered via key principles that have been agreed by all the partners and stakeholders. The first principle is a whole systems approach. This means that we will work across a whole health and wellbeing system, economic system, across wider partnerships, all to improve health and wellbeing, in recognition that health is not just a determinant of how much food we eat or how active we are, but actually health is determined by the environment we live in, our jobs, our income, and many other factors, including training, skills, and education. The second principle that we deliver to is the principle of prevention and early intervention. The third is self-care and management of own well-being. Then we have a place-based approach as well, which this is in recognition of the fact that certain areas of our district require more resources and more input than potentially other areas. We have a life course approach principle, recognising that people at different stages of their lives will need different interventions, different services and different needs. And all these with the overarching goal of reducing health inequalities in our district. The governance of the strategy. The strategy is governed by the Epping Forest Health and Wellbeing Board. The Health and Wellbeing Board is a multi-agency partnership board made up by statutory partners across our district and from Essex County Council, and also third sector partners. The strategy is delivered via themed multi-action groups, multi-action agency groups. The groups are aligned to the Robert Wood Johnson Health and Wellbeing Principles. As you can see there, we have Healthy Behaviours, Socio-Economic, the Community Safety Partnership, a Clinical Care Action Group, and a Built Environment Action Group. Each year, the action groups deliver on the priorities that they identify. They identify the priorities via a consultation between partners and come up with an action plan that identifies any gaps that we have within our system. The plan is then ratified by the board and then delivered upon each year and refreshed annually. The plans aim to identify and add additional value to what is already taking place within our district and not duplicate. Our next stage of the presentation will go on to talk about each of the action groups and the priorities that they have delivered against and some of the key projects and the impacts they have had. Rachel.
Thank you, Fabrizio. So from our perspective, one of the key cornerstones of healthy behaviours is physical activity, and as a representative from Active Essex, I'd just like to bring some of the projects that we've delivered over the last financial year. So from my perspective, the Find Your Active funding that's been allowed to be brought into the district is absolutely pivotal to be trying to change behaviour. As we know, we've got those who are inactive in the district, and we want to try those to make them a little bit more active and then to actually become active, and that's sustaining 150 minutes of activity across the course of a week for an adult. I'd just like to take you very quickly through 3 case studies. The first one being Dennis and Dyer, which is a boxing academy in Loughton. Here you're looking at young children ranging between the ages of 6 and 15 with barriers to physical activity. So before this intervention began, they were completely inactive. And actually the reports coming back from education settings is that they were being disruptive and had a lack of discipline. And actually the family unit wasn't somewhere that they felt safe and secure. So the main objectives were introducing young people to the benefits of boxing, but ultimately to improve their confidence and their self-esteem. Now, before I go on just to say what the parameters and the KPIs were, can I please ask Matt to please play the video, and fingers crossed you'll be able to see a case study, and that will bring it to life.
I'll just get you to stop sharing first, if that's all right.
Yep. So
boxing is just massive to these kids in this area.
Boxing is amazing because you get to express yourself and you can do anything you want. You won't get judged. And it's like, you're never really alone.
Denison Boxing Academy, we deliver boxing sessions to boys, girls.
We teach them from the stance and guard, catching, parrying, throwing the jab properly, so we've got a good balance of fun and learning.
And we're currently working on a fantastic project with Find Your Active for us to get more kids training, more kids off the consoles, and we've seen a rapid amount of interest.
When Lenny came here, he was very introvert, but since he's been coming here, he's completely come out of himself. His anxiety now is literally non-existent. He comes in, he loves the banter.
I was struggling with everyday things in school, so like staying out of trouble and that. Like with the box, you're like really disciplined in that, and it's really helped me.
Boxing is like the most kept secret in the world. It's actually good for you mentally and physically, and it gives you an amazing amount of confidence, and you walk away a better person every single time.
School, started like getting really angry, start punching walls. So I think coming here, it would like help me. Instead of punching walls, I'd be punching the bags.
The London Marathon Foundation money has helped them immensely.
That funding just allows us to make it happen.
We've seen a massive increase in from all different backgrounds in the area of Epping. Didn't even do it. Whether it's just not even knowing what it is.
Boxing and helping the community is very close to our hearts, and we want to give everyone an opportunity to come here to keep fit, learn some boxing. So it fills me with happiness when you see people go off and be happier with life and have a brighter future.
It makes me feel safer, and it feels really enjoyable for me because I didn't really have much things to do at home, and now I get to do all this amazing stuff.
Lovely, thank you. So that hopefully gives you a little bit of a flavour of some of the success and the impact that came out of that project. I can confirm that project has been sustained and the organisation has been successful in securing future funding to be able to develop further interventions. So the second one to bring to your attention is the Wellbeing Wednesday at Buckhurst Hill Clinic. This actually has got 4 different organisations with regards to the collaboration. So you've got Voluntary Action Epping Forest, who come from an infrastructure review kind of type organisation, Loughton, Buckhurst Hill and Chigwell PCN. So the 4 of them decided that actually there was a real need in the community for those who have got social anxiety and mental health barriers. And the objective is actually, let's try and engage you in something with regards to mental health and well-being and a bit of an education around what the benefits are of activity. We were really fortunate at our last meeting for the subgroup to have a representative from the PCN and actually the local community connector come in and tell us about some of those successes. And from a participant, or I should say a user of the GPs, they are lessening their visits and actually being able to engage and socially interact in the community further, which is lessening the burden on those primary care networks. The final one to bring your attention to is the Senior Wellbeing Hub at Budworth Hall in Ongar. Here you are looking at those residents who are the age of 65 that can stand independently but at the same time need to increase their mobility and their independency. The main objective is to keep the participants mobile, flexible, safe and independent so that they can continue to live at home. And the idea is that they will increase their confidence and in their abilities. From the people who attended, there are 18 of them were regular attendees, and actually 80% of those were female, which books the trends with regards to additional sessions, particularly in this demographic. So if I could just give you a soundbite of actually Rita, she's one of the participants. I haven't got Rita's age, but fingers crossed. Matt, if you can share the audio link, you'll be able to hear what she finds beneficial about the project.
Introducing Rita Wuthers. My name is Rita Wuthers. I joined the club on the first day that it started, and it's the best thing I ever did. I will not miss a Tuesday morning for anything. It's really a wonderful class. The 2 staff are absolutely 100%, and also not only exercise have I benefited by, I've also benefited from our mental state. because the two people who run it are so good, and I wouldn't miss it for the world. Tuesday mornings comes first in front of everything. So, and I've got much better in walking. I stand up straighter now. I'm not bent over. So it's absolutely wonderful. Also, I have joined the Friday Club, which has also helped me. And I really enjoy that one, which has also benefited me, as I say, physically and mentally.
Thank you, Matt, for your assistance. So those three projects really bring to life some of the opportunities that we've been able to fund, and I really want to be able to stress that these are community inspired. They are not any, although gaps were identified in the frameworks that exist within the existing subgroups, we are not telling communities what they want. They are absolutely informing and telling us what they want, and then we're trying our very best to marry that with resource and capacity. And as you will see in your report, the additional funding has been leveraged in. So it's not about exactly what the council has. It's been able to work with different partners, such as ourselves, to be able to bring additional money into the district, which I think has been incredibly successful. So thank you, Fab.
Thank you, Rachel. We'll pass over to Joe to introduce the Socio-Economic Action Group.
Thank you. So, I'm sure you'll appreciate that although there's a socio-economic covers a wide range of topics, it is the cost of living crisis that has predominantly driven the projects that we've worked on in the last year. It's really important that we, as Fabrizio said, that we work in partnership, because there's a limited amount of resources. You know, the clients that we're seeing are experiencing limited resources, but so are the organisations. So the more that we can join up together and work together, then the more effective we can be in supporting people and reach as many people as possible. I'm afraid that my favourite case study, and I don't have whizzy videos or anything, is the hub in Waltham Abbey, because it was a flagship service that came out of COVID, and it was, it was a project that we actually had mapped out pre-COVID, which I had already identified the link between positive mental health and positive financial health. So generally, the two things are inextricably linked. And either people in poor mental health can't focus on their finances, or people who've got financial concerns have underlying then mental health, anxiety, depression, caused by lack of financial well-being. So the two things very much go hand in hand, and obviously coming through COVID, they were exacerbated. We wanted to, we identified Ninefields as a community because it's one of the most deprived areas in the district, but we also wanted to work in a locality where we were very close to lots of other things going on. So we chose a non-stigmatised venue, hoping that people would actually be happy to come into a leisure centre that was brand spanking new, rather than queue outside a formal council building or what have you, which is how Citizens Advice had delivered services in the past. We partner with Mind, ePut, they're two mental health services. We have the Department for Work and Pensions that come along, and someone from the Revenue and Benefits team. And those partners change according to whether the needs change. So when we first started, for example, we thought there would be a lot of need for digital support. Actually, that wasn't being taken up, and so, you know, that sort of offer was taken away. We operated initially on a monthly basis, increased that to weekly because there were enough people demanding the service, and we now get around 50 visitors coming in every month. And, you know, it's not just citizens' advice they're coming to see. And people often cite the fact that it is in the health centre, in the leisure centre. You know, I've got a case study to tell you about, which is John, who, single parent of 2 primary age children. The leisure centre was on his way to and fro, dropping his children into school. And he was bringing up the 2 children, but he had his own anxiety and depression issues, which meant that with the childcare arrangements and those mental health issues, he was struggling to work and had actually fallen out of the job market. They were in a 1-bedroom flat, and he was constantly worried about homelessness. So when he came into the hub, he was supported to access the benefits that he was entitled to. He wasn't even claiming child benefit. He was supported to access the housing portal to start bidding for bigger properties. He had one-to-one mental health coaching, which significantly improved his health and well-being. He was referred into other healthy behaviours, so the family got a free swimming pass, which is funded through Active Essex. So you can see that, you know, the groups do actually interlink. And he also had debt management advice because he'd been building up debt. So he eventually, after, you know, these interventions are not one-offs. They take time. People take time to trust us with really all the issues that are underlying. But he is now back to work. He's managing his finances, and he feels like he's parenting better as well as a result of the support that he's had. Another project that we've worked on, and this is looking at older people specifically, but about £2.9 million in the district of Epping Forest is going in unclaimed guaranteed pension credits. And we just felt that there is a really, you know, there's a stoicness in older people accessing what they consider to be benefits, but actually these are entitlements. And so it's around looking at working with the revenue and benefits team at the council and saying, how can we as partners get that message across to the people that we're seeing that are entitled to this money and could be improving their quality of life with money that's sitting there waiting for them to claim. So I know that since April, Citizens Advice have supported 30 people to actually make a claim for guaranteed pension credit. It's quite a slow burn, this one, because it is, as I say, covering an issue that older people tend not to want to talk about. Energy affordability, you know, you can't watch Martin Lewis's programme without knowing that energy affordability is a major issue. It was actually in the report as one of the issues, top 4, I think, issues that have been identified by people in the housing report. The district has very much encouraged the warm spaces approach last winter around organisations and community assets being opened up to the community so that people had somewhere warm to go. They were so successful that they got rebranded as social spaces because they were tackling loneliness and isolation as well as the whole energy issue. And again, around 200 people using those services. Citizens Advice have subsequently brought in an energy advice team and we have seen since September last year 50 people have been supported with very specific energy advice by trained advisors, and they get having an income gain of around £500 a year through that service. So it's all about, at the moment, programmes that will actually lead to people having their income maximised, is how we like to describe it, so that they can maintain some level of quality of life.
Thank you very much, Jo. So moving on, we're moving on to the clinical action groups now. So within our system, our PCNs and our ICB actually have clinical action groups already set up. So there are actually 4 clinical action groups, 2 neighbourhood groups set up on a footprint of our North PCN and our South PCN. The aim of the neighbourhood groups was to bring together a better understanding and a better working relationship between third sector partners, our own statutory partners and commission partners, and the GP practices themselves. The other action groups are the health inequalities action groups. So the GP practices and the PCNs themselves actually have to tackle health inequalities as well, but from a clinical point of view. So it was determined with our ICB partners that actually those action groups would form part of our system, and we, the district council, would be represented within those groups, so we could all work together more closely. There's been some key projects that have emerged from these action groups. The first one is the West Essex Falls car. So the Falls car is a rapid intervention car that is staffed by a trained paramedic and an occupational therapist. The car operates 7 days a week from 8 a.m. till 8 p.m. The aim of the car was ultimately to respond rapidly to a fall within a domestic setting. The aim is to get to a fall within 2 hours so that the person who has fallen is not left on the ground and deteriorates further and then is conveyed into hospital. The car itself has been in place since the summer and has produced and has actually had a huge amount of uptake. As you can see there's been 491 calls removed from the ambulance stack. The ambulance stack is effectively the calls they get from the ambulance. The 999 calls are then diverted to the Falls car. So it's calculated actually that a fall within, or any ambulance call-out costs £367 to take someone onto hospital. So if you consider that 491 calls were taken from the ambulance stack and 73% of those were triaged and non-conveyed onto hospital, there is a huge potential saving there of over £180,000 just in the 6 months this project has been running. Not only that, add into the quality of life. People are not lying on the ground for long periods of time. They're being left, basically treated within the home. We've got ultimately huge benefits to the health and well-being, particularly of our older and more vulnerable residents. That was a key project that came out of the neighbourhoods group. A key project that's come out of our health inequalities group is the Loughton Buckhurst Hill Chigwell Health Inequalities project. So our PCN identified that they had a huge issue with health checks from areas of inequality. They had about 500 patients who were 55 or over in areas of deprivation who had not had a health check in the previous 5 years, many of them with underlying health conditions. So the aim of this project was to get those get a health check and detect any further issues or even prevent any issues, onset of any issues. EFDC, ourselves as a partnership and through the action group, we coordinated a partnership project with the PCN, working with our local college, New City College, where in one evening we hosted a health check or a health MOT session. The health MOT session also saw support services come in. We had 7 different services there, so people could be onwards referred onto other projects or services. The checks were conducted by clinicians, but supported by volunteers and students from the college themselves, so they gained valuable work experience. And in addition, there was partner agencies, as I mentioned, to support, so people could be referred on to things like health and wellbeing, energy support, or other services they might need. The evening itself, we saw over 300 patients in one go from areas of Loughton, Buckhurst Hill, which cover the South PCN. And there was 120 onward referrals to support services. Another key project, again, looking at older residents and vulnerable residents, is our Social Active Strong project. So Social Active Strong is commissioned via the ICB, and it's a falls prevention programme. The programme offers 12 weeks of free activity across locations within our district, and often the service is flexible, so depending on where we get the referrals, we will increase number of classes in those particular areas or reduce in other areas where there's not as many referrals. The aim is to give people 12 weeks of free activity so they can improve their strength and balance and begin that path to being physically active and then onwards refer on to other activities. In 2022-23, the service received just for Epping Forest for West Essex 644 referrals. 75% of those completed the programme and 81% improved their physical activity levels. 66% went on to report a reduction in their fear of falling. So as you can see, some key projects working across both clinical and community elements. The final action group is the Built and Natural Environment Action Group. The aim of this action group is to look at how we can improve our environment locally, looking at new developments and how we can build in health and wellbeing into new developments. A key project that's come out of this area is health impact assessments. So health impact assessments are effectively an assessment of a development. The developments need to meet a threshold of 50 residential developments or 100 square metres of commercial to be assessed. What this aims to do, the assessment aims to bring together all of the different impacts that a development can have, and then from there quality assess what a developer is saying that they will do to address those. Assessments are quality assured against the Welsh Health Impact Assessment Unit's quality assurance criteria. The aim of health impact assessments is not ultimately to use a stick to beat developers or be negative, but actually to highlight what developers can do and promote healthy impacts and healthy developments within our communities. We've got a lot of housing going on, so we want to make the most of what these housing can do. That can be looking at green space, connectivity, it can be looking at jobs and many other factors. And then any negative factors that might be there, mitigate them with the help of our own teams within health and wellbeing and also wider services. So they're ultimately the projects that have been delivered this year and some of the impacts they've had. Our next steps for the Health and Wellbeing Board and the partnership strategy is replicating our place-based approach in other areas. So the place-based approach that has happened in Ninefields, which you heard the hub as an example, has actually even had a greater impact and there's been more services delivered. What we will be doing next year and in the following years is actually replicating that into other areas such as Oakwood Hill in Loughton and then Limes Farm in Chigwell. To support this, we've actually applied for additional funding from Essex County Council from their Public Health Accelerator funding. We've asked for £250,000 for additional support in terms of staffing, so we can have staff who are solely allocated to those particular areas and can work with the partners and with the services to embed them in those areas and work with the community to develop their own projects. In recognition that health is affected by more than just food and lifestyle, we also aligned our socio-economic priorities, so our economic development priorities with our Health and Wellbeing Board and the priorities there. So what we're looking to do there is use some of the UK Shared Prosperity funding to bring in training and skills development in some of our most economically deprived areas, again, with a place-based approach. So Loughton, again, Oakwood Hill, and Chigwell and Ninefields. So we'll be investing in skills and training programs and working with New City College to actually come out and deliver within those communities and not expect people to come to the college itself. In respect of the Council's Fit for the Future programme, we'll be looking to expand our partnership development and our partnership working with our ICB, looking at how we can collaborate better across services, collaborate better in terms of posts and priorities, and also resources that we have in funding, and align that funding both from the ICB and our own funding and also County Council funding to ensure that everything is aligned in terms of this place-based approach and tackling health inequalities. For our multi-agency action groups, we will be refreshing our action plans and looking at new priorities for the coming year. And we'll also be looking to publish a full report on what the impact of the action plans this year. And we'll also be publishing a report onto our dashboard. As you might have seen in the support documents, there is a dashboard that gives the baseline data for our health statistics in the district. We'll be looking to update that this year and putting new statistics to show the progress of the strategy. Thank you, Chair. Any questions?
Thank you very much for that detailed presentation. Before I hand over to members, as I've mentioned already, I chair the Epping Forest Health and Wellbeing Board. I've been a member of the board since 2016, and I started chairing it from 2019 onwards. The creation of this strategy document that we're reviewing this evening was probably the hardest strategy document that we've had to bring forward as a board. And the reason for that was obviously because if we think about where we were at the time that the strategy was being developed, it was in the post-COVID era. But I think in order to get this strategy document to where it is now, it wouldn't have happened without the partnership working and the great relationships we had with our other community groups and organisations. And it was really a joint effort to put this strategy document together. But when we the main thought process around that though was to align the strategy that we were bringing forward with the strategy that other health groups and other groups that were responsible for community engagement, making sure that all of the all of the strategies aligned, so that weren't duplicating resources, but working towards a common objective. I think over the years, the success of the group has also been down to how much money we've been able to lever in from external partners. And when we consider that actually within our budget, within the district council's budget, there is a small amount that's allocated to the Health and Wellbeing Board, and the communities team, our communities team, which have led on a number of the projects as well, have been influential in that customer-facing piece of work. But again, without our relationship with our partners, we wouldn't have achieved the successes that we've had. And some of the projects that have been mentioned, but particularly the project around the social isolation piece that we did, we initially piloted in Buckhurst Hill and then rolled out to Shelley, and it showed how having a whole systems approach, but having a place-based approach as well, where we could bring in partners, other departments within the council, and concentrate on a particular area with a common objective, an end objective to achieve, was what brought about our success there. And I think, when we heard the place strategy, I think it came to overview and scrutiny a few months back, it was actually, when that was presented to that committee, a lot of what was being said was essentially what we did back in 2020-21 when we went out into the community and engaged with our residents. I think one of the other areas that I've really tried to focus in on has been around being able to demonstrate the benefit we've had to our community. Now, it's very difficult to do that because a lot of what we do is prevention. So how do you establish a cost of prevention? It's quite difficult to do. And I know we've brought forward KPIs, which non-tangible KPIs, and it only tells half the story really, and half the success. But I'm going to be chairing my last meeting next month, and while I'm on webcast, I'd like to say thank you to every single member that has participated in the board over these years, because without your engagement, we wouldn't have had the successes that we've had. But I'm going to embarrass Jill now, because Jill was involved with the board longer than I was, and without Jill's ability to be able to work and bring on board partners, we wouldn't have had the success that we've had. When I first got on board with the board and I look at where we are now, we're in a much, much better place. And it took a long time to establish those contacts, particularly with our health partners from the ICB. We really had to break down boundaries to get to where we've got to. And that is testament to Jill's hard work and the team effort. It's always very modest. But we've got cabinet members here, and at full council budget setting meeting, I did say I was going to sing the praises of the communities team, And I know when we do consider the budget setting process for next year, I'd like to see an improvement in the budget towards health and wellbeing. But if that can't be granted, at least maintain the budget where it is, because it is very customer facing. It's what our residents see firsthand, and it's important that that's maintained. So I've had my little speech. I'm going to hand over to Mr. Marshall now.
Yeah, I don't begrudge anything that's been done, and I think it's excellent work that's been done. However, you don't seem to do anything for the rural parts of the district. You know, this has all been urban-based. All these, you know, Bacchus Hill, Chigwell, Loughton, all Waltham Forest, you know. What's happening in Morton? What's happening out in Fifield? What's happening out in the Outlands district? There's probably more loneliness going out in those districts than there are in the urban areas. Economic, out in there, you know, it perhaps costs more to heat your houses out there. You haven't got the transport. You might have extra transport costs. But you don't seem to have anything aligned for those areas. And that, I don't begrudge, I don't mourn anything you've done, but I think there's a lot of people being missed within the district.
Mr. Ferrari, you want to come back in on that?
Thank you for that question, and yes, noted. Unfortunately, with the limited resources we have to go with the data we have, and a lot of the data indicates particular areas. That said, we are trying to do a service that covers many of the rural areas as well. So things like our warm places, many were in rural areas because we identified the need in rural areas and worked with our churches and community groups in the rural areas to put them in place. There's a report available on the Warm Place if you wish. And again, we need to grow that, and we need to grow our links with our community to grow those resources in those rural areas. With our alignment with economic development, what we're able to do is look at some of this UK shared prosperity funding and use it in our rural areas to improve and boost services. So we will have a digital tender coming forward, which will look to target particularly rural areas, look at digital inclusion in those areas. We'll look at improving facilities, so lots of our funding from our Rural Prosperity Fund has gone to facilities in rural areas to boost those halls, so we then begin to deliver services out of them. And also our community champions themselves. We've got our community champions pretty much covering most parts of our district, and they themselves are an integral part of the delivery of this strategy, because what they do is they work with the local community to put in place projects within those rural areas where, you know, we need that support from the community itself, because we might not necessarily have the budget, but they've been very good at levering in funding to additional resources and services. So there is a lot going on in rural areas. This strategy is ultimately an encompassing of everything, and we haven't necessarily highlighted here what is taking place in rural areas, but I can assure there is work going on to do more.
Yeah, perhaps you should highlight the work that's going on in the rural areas, so it's not omitted, so that, you know, people are aware that the work is going on, you know. And the other thing, where do people hear about these groups? I mean, because I've never heard of I've never heard of any of them. So where do people get to know about these groups? Where is it advertised for these people to come along?
Definitely, we'll note that in the report to highlight the rural areas. In terms of marketing, marketing's a difficult one. We do a lot of marketing on social media. We do a lot of marketing via our links and onward referral via the PCNs, our social prescribers. We have a health and wellbeing coach embedded within the primary care networks within the GP practice, so we try and do a lot of that onward referral through those areas, but also social media and marketing, flyering, local magazines. It's a very difficult, it's a hard nut to crack in terms of marketing, and I agree, but we'll try, and we will continually do that via our partnerships and links.
Just following on from what Mr. Ferrari has said, we've also got access to the screens within GP practices as well. So whenever community projects are being initiated or other projects, we are able to ask the practices to put them on their screens. And also the leisure centres as well are another good area where we're able to advertise community projects that are taking place.
Surely community places like leisure centres, I'm not disputing that, but aren't they the places that people don't go to that have these problems?
If you look at the example of Waltham Abbey, actually the leisure centres are seen as a community hub. I mean, if we have a hub within Waltham Abbey itself at the leisure centre, so it's actually managed to reach out to many of our to reach parts of our community and residents who would have never gone to a leisure centre. So it allows us to then work with them to build in other elements of their lifestyle. In terms of marketing, again, there is community groups that are developing it themselves. A lot of our community champions do their own marketing. They are the leaders in their community, so they will do that themselves with additional support, you know, a budget for printing flyers, etc. So town halls, there is a wealth of areas that we can market on that we do try, and any more that become available, we're constantly trying to expand our reach. But often it can be down to just simply word of mouth, and we try and build that into it as well.
Did you want to come back in, Mr. Marshall?
But one thing I've noticed, that not only from your point, there's no notice boards anywhere for Epping Forest, for example, in Loughton, in the Debden area, advertising all these things that are provided by Epping for residents and tenants in Epping. Can't that be something that's done? Simple.
We have worked on our relationships with the town and parish councils because they're the ones who control the notice boards that are distributed around the district. But so we do. So the information is circulated through the other councils that support us. Councillor Whitehouse, you indicated to ask a question.
Thank you, Chairman. Yes, I found that a very interesting report, but I'm particularly interested in the Built in Natural Environment group. In the last couple of pages of your report, page 46, you talk about your main outcome to be to influence a change in planning policy. It looks as if this is very new, but it's a thing you spoke most about. I just wondered what discussions you'd had with planning and you know, how you see that going forward. I really look forward to seeing on planning applications a reference by the planning officers to the paragraph about health. So that's sort of my main question, but also on that where you've got your objectives and action things, you've got various abbreviations which I have no idea what they are. HIA, DM, LCWIP, SPD. Would really appreciate those being in full. Perhaps later on you can give me an explanation of what they stand for, but it's, you know, some of them are quite meaningless without knowing what those stand for. Thank you.
Thank you.
So thank you for that. So in terms of the Built in Natural Environment, it will be chaired. It's a group that will be continually evolving. We're looking to have a chair from our planning team itself to influence that and to support that. Planning is different to the other areas in the sense that it's harder to bring about change quickly. With some of the other areas, as you know, you can do a physical activity program, etc. But it's probably the area where we can have the greatest change. So in terms of HIAs, as you mentioned, that stands for a health impact assessment. So a health impact assessment ultimately is what impact a development will have on the local population. And they have to be done by all developers if they hit that threshold of 50 plus. It's a county, it's directed by county, the local planning officers, county council, and it's been brought in even at a local area. So this year what we've been able to do is actually embed that within our planning policy process. So any developer who comes in with a new development that hits that threshold has to do a health impact assessment. And that health impact assessment has to hit a good standard. And that good standard comes about from it being quality assured by our public health team. And if it is not quality assured, if it doesn't meet that standard, then it has to go back to the developer to redo. And what the developer has to do actually in that health impact assessment is say the impact that that development will have and any mitigating factors they will put in place to address that. So it's a really key document, and it builds in lots of the other factors. So we get consultation from our health colleagues, we get consultation from third sector partners, all to be able to build this process into this health impact assessment. In terms of forward thinking and looking forwards for this group, one of the key things that the county bring about is a healthy weight strategy. And we will use this group as a driver for that healthy weight strategy, because what that healthy weight strategy will begin to do is implement recommendations around how we improve our local areas to become healthier. Some of that might be around supplementary planning documents. So the SPD you mentioned stands for supplementary planning document. A supplementary planning document is an additional document that's put into planning policy. Other areas have done this really well, where they've looked at areas where there's a real level of obesity and brought in supplementary planning documents to limit the amount of fast food outlets, for example, or do other things that bring about change in terms of healthy lifestyle. So that's where we're looking at areas. Then other elements as well, with the UK Shared Prosperity Fund, we've been able to bring about a local walking and cycling infrastructure plan for Waltham Abbey through this group to begin to build and look at infrastructure in Waltham Abbey. That's the first step to then be able to bid on to planning policy, to funding for transport and other elements, infrastructure. And then we'll have a playing pitch strategy update as well, which is key to look at playing facilities and play facilities. So there's lots we can do within that group. We just need to grow it within that element of the planning policy and the planning world, which is a little bit more difficult.
Thank you. Councillor Mead, did you? Yep, Councillor Mead.
Thank you, Chair. I'm just interested in, sort of leading on from the question about how people find these groups. The group you have, for example, in Buckhurst Hill for mental health, was there a criteria for those people joining the groups, or do they just sort of turn up? I just was interested in the model of it.
So most of the participants were identified by the doctors themselves. So when going into surgeries, they were able to work with a social prescriber, and then instead of taking on clinical stroke drug treatments, etc., it was a case of actually let's have an alternative subscription, and that was when they were signposted to be able to take part in that session. So you wouldn't necessarily walk straight into that, you would need to be referred into it, but it would be after you'd been clinically assessed.
Do you want to come back in?
So theoretically, there could be a lot of people being missed who you wouldn't necessarily go to a doctor if you had a mental health issue or if you were feeling depressed. So what about those people? How are you going to get access to those people?
Yeah, this is just this project is part of the greater, I suppose, mental health offer. If those people, I suppose, wouldn't necessarily go to the doctors, there'd be other referral agencies that they'd be able to go into that exist across the I suppose, the whole of the landscape. Fab, would you be able to expand further?
So in terms of people with mental health issues that may be missed, so the fundamental part of our hubs, as in Waltham Abbey that we'll be developing in other areas as well, is that mental health practitioner. So the PCNs, the primary care networks, each have a mental health practitioner. That is their aim is to be out in the community, so they can visit people in a community setting, people can drop in and speak to them and then go through for an onward referral, onward transition. The one in Waltham Abbey has worked particularly very well. We're looking to work with our mental health practitioners in the south of our district to come out of work in the hub at Oakwood Hill. We've recently worked with our mental health practitioner again in the south of our district to work in the Buckhurst Hill out of the Noah's Ark. They're going to be running a session there and then developing an art therapy session off the back of that. So it just takes time to build those connections and then work where we've got local assets to being able to work with the health service to bring their assets out into our assets within the community.
Just to follow up on that point, I think one of the successes or one of the key points that was driven out of the social isolation project that was initially piloted in Buckhurst Hill was around how well the community knew each other, how well do you know your neighbours, and I think it's really important that people are properly signposted. So if you're aware of someone within the community that you may feel will benefit from one of these services, that they're properly signposted, that you support them in signposting them to these groups, so that they can get the relevant support that they need. Councillor Lucas.
Thank you very much. I think this is a huge success story, really. I absolutely take my hat off to all of you and all of your contributions, because it's something that is so important for our community and is actually worryingly increasingly so. Just thinking particularly around school-aged children, I know that there is definitely an increase in mental health issues following the, whenever are we going to stop saying post-COVID, but post-COVID, and it is true. And I just think that everything that you've doing is great and obviously making great progress, and it's really, really good to hear, and listening to what we've seen tonight and how passionate everybody is that's involved is really, really good to hear. I will, however, just like to concentrate on the strategy and thinking about this strategy and the progress of the action plans. I'd just be interested to get your opinion really on when we're like, obviously this has come to scrutiny now at the end of the financial year, you haven't yet done your review of this year's action plan, and I'd be interested to see how that corresponds to where you was last year and where you plan to be this time next year. I think it's really important, and I know that we was mentioning that the KPIs are really hard to sort of indicate the progress, because everything you're doing is fantastic, and you're listing all of these fantastic groups and everything that we're doing for the community. But it's really important that we see that that's progressed, and it clearly evidently has, but if we can see that within the action plans and sort of on paper, so that we can see how many more sort of groups, how many more people we're reaching, so that then we can see and compare more on what we've done, and we've reached out to these more rural areas, and we've had this many more attendees in these places. I just think that would be quite useful for us to see, rather than just hearing, and I am really pleased to hear of all of the fantastic stories, but next year you could reel off the same amount, you could reel off more, you could reel off less, and we're all going to be going, oh, this is fantastic, but it would be really good to actually see the progress on that. But thank you.
That's a really important point that you've made there, Councillor Lucas. Mr. Ferrari, you want to come back in on that?
Yeah, certainly, and yeah, very good point, actually, and the dashboard is aimed to be that measure. Unfortunately, with the dashboard, the data within that is cyclical, so it comes out almost every financial year. So to be able to identify the improvements we've made this year on the baseline of the dashboard that was in the appendices, we'll have the data probably in April of 2024. So what we could do is come back at the same point next year, and we'll have the data of what we did previously and then how we've addressed that data and improvements. And also, again, measures around, like you said, the activity, the engagement. We can look at actual physical, I suppose within the report that we will be writing, it's look at the physical measures in terms of how many people we've engaged with the projects, the impacts they've had. That would be a key element. And that dashboard actually itself is being utilised by County Council and our partners across West Essex as a model of good practice. The ICB are going to be using it as well. So we're all integrating into this kind of bigger system, and that data sharing will be key as well for us, because we will then be able to access data from GPs and the ICB to show us our progress as well even more, and it will be more up to date than maybe waiting for an annual publishing of data.
Yep.
Thank you. My thoughts on it would possibly be to consider having it at the, right, if you said the review's in April, maybe consider it in May or June, because then we'll be looking at the more up-to-date data rather than us being able to consider the data that was 2022 to 2023. Just maybe something to consider. Thank you.
It's a really important point. I think it's something to take away and consider. So, members, we've had our opportunity to ask members of the board questions. So this item was for noting. So can I take it as noted, please? Noted. Thank you very much. And thank you very much for coming to present this evening. You're more than welcome to stay for the rest of the meeting, or you can leave if you like. So the next item on tonight's agenda is customer service update. And we have Tracy Scott, the team manager for customer, who's going to present this report. Thank you.
Thank you, Chair. Good evening, everyone. So I'm Tracy Scott. I'm the Customer Service Contact Centre Team Manager. And I just want to take this opportunity to kind of give a progress update in terms of where the contact centre's at the moment. And I guess seek your comments, questions, views around us reviewing one of our current KPIs around the customer satisfaction. Forgive me if I say CSAT, the customer satisfaction. So what we've identified is that current KPI, which I believe has been discussed at length previously, is probably not currently fit for purpose in its current format. So what we want to consider is proposing KPIs around the contact centre that show the customer experience of the contact centre. So I'm hoping you've all had an opportunity to have a look at the paper that was submitted, and I'm just going to go through a few slides that will pull out the key points that will help us give context to in terms of the KPI that's being proposed, and also just give an update on the contact centre's performance, what's taken place so far, and our views with regards to an improvement plan moving forward for customer services, and how that will all link in with our Fit for the Future programme. So just to give a bit of a background with regards to the contact centre, we are open, our opening times, but I thought I would give more around what we do. So the customer contact centre, yes, predominantly does take phone calls, and on an annual basis, around 63,000 calls come into the contact centre. Since being open back September 2021, along with the community hub, we see approximately 9,000 customers come in to see face-to-face support. We are a contact centre, which means we don't just do phone calls, we also have online queries. So we see around 12,000 emails per year, as well as other online requests. So you can request a special collection or report a misspin using our online forms. And we see around 9,000 of those. And we monitor throughout the day certain social media interactions as well. And managing all of that is done by a head count of, or a full-time equivalent, so that's 8 full-time people and 1 part-time person. So, carrying on with the background, as you know, hopefully you know, we had a new telephony system implemented in Q3 on the 19th of October, and we are seeing benefits out of that system. There are still a lot to learn, and we are working with the business partner on that and the service provider. It's a system with a whole plethora of data that's coming back out on the back of that, which we are working through, but also it has a lot of capability and functionality that we are still learning and still getting insight on, so that we can provide look to see where we can provide a more efficient service. But for example, I have, as the contact centre team manager, I now see more real-time behaviour of how our calls come through and how those calls can be prioritised. So that's definitely been one of the benefits of having the new system rolled out. So over the past 12 months, going up to Q3, we have had some challenges with our KPIs, and they have been discussed at the various meetings. One of the things we did see with our Q3 is our first point resolution. So that's when somebody calls and we can resolve that call in its first instance. We did see that come down, not to say that we don't believe that hasn't been done, but again, Q3 is where we got the new telephony system, and we just feel it was a learning exercise that may have diluted the data. We have also worked with the service provider to get more robust, without getting too technical, the drop-downs that we get to say how we resolve the call, to get those rationalised so that we can get more robust data out of that system. But what you can see here is currently we have one KPI that actually measures the experience a customer gets when they call the contact centre. And the other 2 KPIs that we've been tracking for the last 12 months are actually council-wide. So the formal complaint KPI around us responding to 85% of our complaints within 10 working days, that's corporate. So it sits within the customer work stream, but actually it could be a complaint for any service across the council. And the overall customer satisfaction. So again, the contact centre will either send out that survey, or the form the customer fills in, it automatically does that. However, the feedback that I see, if I do get any verbatim comments, it's not pertaining to the contact centre, it's pertaining to either my bin wasn't delivered or I'm waiting for a response on something. It tends to be the service area has not delivered what potentially they should have, or it's just policy was applied and unfortunately that decision wasn't likened to. So again, it's a KPI that is very difficult for me to influence or make changes around, because it doesn't actually impact my service area of the contact centre. So review and progress to date. We have been working on many other things. So one of the things we've been doing is reviewing ways of working, especially since the telephony system came in, looking at things we can do differently and try and gain, I guess, what we would call quick win efficiency. So these are efficiencies that we don't necessarily have to go to IT for, potentially. These are things that we can do within ourselves as a team, and we will continue to review those. We've also done a benchmarking exercise, which the full information on that was included within the report and the appendices. What that did highlight to us is it's very hard, even across just 14 local authorities, to compare true apples for apples, let's say. But where we could get close to that, we did identify that customer satisfaction is measured, but in terms of a KPI, only 4 local authorities are doing that at a cost and doing that in many different ways. So again, it's around whether we still want to continue with that KPI and understanding the value that it's giving us. So some of the next steps that we, as a contact centre, have been focusing on is looking to develop a short, medium and long-term improvement plan, which has to be underpinned by the Fit for the Future transformation, which should also include a digital customer pillar. And I include that because once we are part of that transformation, we need to understand of our customers who are digitally able, so of our customers that can do click and collect or maybe do bank online, how do we encourage them to engage with a digital journey with us? So that then allows our more digitally excluded or our more vulnerable to really call us, and we have the availability to answer those calls. Again, establishing KPIs, key performance indicators that are truly fit for purpose, so that they do measure what the service of the contact centre. And I think one of the things that's very critical to that, as well as working across with other service areas and understanding the end-to-end journey. So again, being customer facing and that first point of contact, sometimes we signpost, or a lot of the calls we do, we signpost to other service areas, but we need to work with other service areas to understand, well, once I signpost over to you, let's come up with some agreed ways of working. Let's come up with our own kind of code of conduct and how we want to ensure that the query is resolved, the customer gets the best service, and so on. And one of the key things that we do want to do is ensure that the KPIs that we agree to do measure that and include that. So the proposed KPIs that I would like a guest comment, or I invite Scrutiny to comment on, as whether the proposed KPI below measure that are fit for purpose and demonstrate the service of the customer contact centre. So what we're looking for is, or we're proposing is an answer rate. So I'll just give some context to that. So if 100 people call the contact centre and we answer 90 of those, that means we answered 90% of the calls. And of those 90% of those calls, the first point resolution works quite closely with that to say, well, of those 90% of people we spoke to, did we do first? How much did we resolve on that first point? And then we'd want to also retain the wider council KPI around formal complaints. And we propose this now, or I propose this now, because as well, the KPIs in general will go through some form of review. So it's not to say that customer satisfaction will not be gathered in any way at all, because the comments I see from customer satisfaction today are the comments I get through the formal complaints process, or the general inquiry. And the formal complaints process probably gives us, not probably, it does, it gives us a lot more information about what has gone wrong, why it's gone wrong, and allows for a thorough investigation. So I guess it's not to say we're doing away, we don't want to hear anything a resident saying, whether it be, you know, and especially if it is a room for improvement or for feedback. But there are mechanisms in place gathering that already. That isn't saying anything different to what we get through the survey at the moment. That was just my short presentation on customer services, and I'm open to any questions. Thank you.
Thank you very much, Ms. Scott, for the update. Members, we've got Mr. Marshall indicating to speak, and then Councillor Whitehouse.
Thank you, Chairman. Yes, I'd be agreeable to you dropping the customer satisfaction KPI. The comparisons you did with other councils was very interesting, I can't say I've absorbed all of it, as this is at the end of a rather long report, but I was puzzled, really, in that page 52, I think it is, where you say, what services do you take calls for? And under Epping Forest, you've got all except housing and repairs. I mean, we do, you know, the council does do quite a bit on housing, so I was surprised to see that. If you said housing repairs, you know, Qualis does that. But on the other hand, they also do grounds maintenance. I'm just wondering, you know, when these calls come in that you say we don't do, you know, what do they cover? And I don't think this is quite complete, this bit here. And, you know, what happens to them?
Thank you for that question. So those calls do come into, can come into my contact centre and into the customer service contact centre. So if they do, we signpost them to the relevant housing team. So if it's for tenancy and estates, housing assets, we signpost them on. So we either transfer the call or we give the direct number for that department. And that's purely because under the, I guess, the operating model, housing never transitioned into customer services. So, for example, waste transitioned in, a part of planning transitioned in, and we deal with non-technical queries for those. The housing strategy never transitioned into customer services. So we triage, we will ask the relevant questions to ascertain the need of that person. Is it homelessness? Is it rehousing? To then signpost them to the appropriate department. So a great question, Councillor Whitehouse, because that's another reason why it's difficult for us to get a very high first point resolution, because I guess we've resolved it to the best of our capability, which is to transfer it. We don't have the skill in-house to deal with those. And with regards to anything that's repairs related, we do get those calls, but we signpost them to Qualis because we're unable to register or log those kind of repair requests. Thank you.
Thank you. Mr. Marshall.
Yeah, just one thing, KPIs with other councils. I mean, I think it's always difficult to set KPIs with other councils, because even if you have the same KPI, the way that those KPIs are reached by other councils is different to every council. So do you think it's actually worth KPIing with other councils?
Thank you for that question. You're right, Mr. Marshall. And I think it was more of the approach we took is to not necessarily say we're going to do that because, you know, Thurrock could do it or whoever, but it was to kind of get a feel or a bit of a litmus to understand, are we really off track? Are we off piece with what we're measuring? Or are we kind of in line? The one thing we really wanted to understand was around, especially around the customer satisfaction, is how do you get the customer satisfaction? And again, like I said, some are whilst they're on the call, they say, you know, Mr. Customer, can I now transfer you to this service? Or some do surveys at the end of the year or various different times. So I think you're right. It's not so much to say we want to do it like this local authority, but it was to get a feel for, are we really adrift of what others are doing, or are we heading in the same direction? Thank you.
One other point. I know you're getting this satisfaction. Is there any way amongst those figures you're gathering, the waiting time for people to get to the contact? Because that seems to be a lot of complaints, is how long people are on the phone waiting for.
Thank you for that question. So, yes, I can. We can get that information. It's information, especially since we've got the new telephony platform, it can break down in terms of which phone lines has been waiting longest and what have you. It has been a challenge in terms of the wait times, especially if residents call at a certain time of the day between our lunch periods. You know, my team have to go and have a lunch themselves, so it can be quite challenging. Also, I guess as we look at our call model, I will use that phrase in the sense of how we introduce a call, the body of the call. if we signpost to the website and say next time you could do this and what have you, and then we have to wrap up the call at the moment, send a survey, that all takes quite a bit of time. Just off the top of my head, roughly about 6 minutes per call, to then be able to get to the next one. So one of the things we probably need to look at going forward, which is probably not for solutioning today, but more as a broader transformation piece, is what do we want our service offering to look like? Is it we want shorter queue times, which means we resolve that call quickly and get to the next one, or do we give the customer the right experience? But what that means is there will be an expected wait time. But do we then say, whilst you're waiting, you could go to our website? So, yeah. Thank you.
Thank you for that response, Scott. Councillor Lucas and then Councillor McCann.
Thank you. It's good to hear an update, especially now we've got the new telephony system in place. I agree with the recommendation of amending the KPIs and specifically that overall customer satisfaction that seems completely immeasurable. I have some comments on the proposed new KPIs. The first one, first point resolution, how we're actually managing or how we're determining are they satisfied and has it been resolved? As you quite correctly, my interpretation of something has been resolved is you've passed it to the appropriate next person. That doesn't mean you've come up with a solution on that call. So I think it'll be interesting to see how you actually are determining that resolution. Is it a solution or is it a resolution? Because I think a solution is you've solved the issue. A resolution is you've actually come up with a plan that they're going to speak to the most appropriate person. So that's just a comment on the first one. And then the second one, my second point is also, which kind of comes into it, is if you either consider it as a first point solution and then another indicator that suggests something to do with the further resolutions. So you could split that up so that you could have one that is resolved on that first initial call and the second one could be something to do with was you able to then pass it on, and I don't know if there's a way of them measuring if that was resolved. Probably not something that you can necessarily know. So that's just something to consider though. And then the other one is obviously the council-wide one, and then that's fine. But I also think that it's sometimes unfair to monitor KPIs all on negatives. So I know that's an easier way of measuring it because most people are here and will just complain rather than give praise. But I think it would be also interesting to consider if there's any way that we can, rather than just be looking at the negatives of the complaints that we've received, if there's another way that we can as a council gain information on the positives. So it might be that, I don't know, if there are ever any people that actually send positives, then maybe we could measure those as well. I just think whilst we're reviewing these KPIs, it'd be important to get the right KPIs. But yeah, that's just my comments, but thank you very much.
Some really important, useful comments there. Councillor Lucas, did you want to come back, Scott?
Thank you, Councillor Lucas. So you're right, in terms of the first point, resolution, it is more of a, so if I took that call, I've resolved what I can within my capability. What we do, how the system is designed, we have agreed buckets of what is a resolved call and what is not a resolved call. So depending on what the team pick, the system then sorts out whether it's resolved or not, and that's how we get the KPI. But definitely noted around how do we look at solution, which I don't have the answer to, because that really is working with service areas to understand it started here and the solutions here, and how did we do that. In past lives, I've worked with things like case management tools, which would track that from the inception using a system through to the very end when it closed, and you can track that it's closed and how long it took and work in progress. So that's definitely a conversation for under one of the Fit for Future, I think, work streams on how we do that. With regards to the positive comments, so I am the customer service contact centre manager. I'm also the corporate complaints manager. which does also include, we do get compliments, we do get residents that go out of their way, and just as they can click complain, they do actually give us some great feedback when things have gone right. So we can look at how we can measure that. How we measure that. It's not as many as the complaints, obviously, so it's what that percentage would look like, I don't know, but it's definitely for noting, and we can take that away. Thank you.
Thank you very much. I've got Councillor McCann, and then I'll come to Councillor Allgood.
Thank you, Chair. I suppose just leading on from Councillor Lewis's point, really, I think my instinct is to say if we're proposing that we kind of remove this as an indicator, so overall customer satisfaction, because it's too difficult to kind of aggregate between your team that's front of house, obviously managing calls, and then passing those on to respective units within the council to then get those remedies. I understand that's difficult, and I can see it from your perspective in that you're being judged in terms of customer satisfaction for things that are completely outside of the gift of your team. I do think rather than look at proposing to remove that, it's actually more about asking those more granular questions in aggregating between the performance of your team and the performance of the rest, the respective units that you refer those called on to. So I think with more granular kind of, if we think about this kind of the qualitative questions that you'd ask within the survey, I think that's what I'd advise, more than it's too difficult, let's remove it. Actually, we need to be asking some more granular questions to aggregate between your team and other teams. That would be my sense of it.
Thank you. I've got Mrs. Gould indicating to speak. Did you want to respond to the question from Councillor McCann, Mrs. Gould?
Yes, please, Chair, if I can.
Please go ahead.
Yeah, you're right, Councillor McCann, about the customer satisfaction. And it's not so much that we've just put it in the sort of too difficult bucket and want to walk away from it. It's more that at the moment it doesn't really tell us anything. So we're collecting something and telling you in the chamber about it, and actually it's pretty meaningless because we don't know what we're measuring. Are we measuring the experience? Are we measuring first point resolution? Are we measuring satisfaction with the ultimate response? And things like, for example, someone phones to make homelessness application, and for whatever reason we don't take one because they're not eligible or whatever, they're going to report that they're unsatisfied, but that's not necessarily satisfaction with us or the service. So I think there is something about satisfaction that we need to think more carefully about. But what I would like us really to do is understand what we're going to measure and therefore make it meaningful. And for me, I think that's about the experience as opposed to the end result, because we'll do a lot as a council, unfortunately, I'm afraid, that people won't necessarily be satisfied with. We've got a housing register of 1,600 people. We do between 300 and 400 lets every year. Not everybody's going to get what they want, and that's unfortunately the reality. So I want to have a think about it a bit more, and what I also think is important for members is that I don't want to distract you really from the sort of customer transformation journey that we need to go on and the end result that we need to get to, but with a focus on sort of meaningless data. And that's where it's born out of, really. So absolutely hear what you say about, let's not just say it's too difficult and walk away. That isn't necessarily what we're doing. We're putting a bit of a pause on it to think about how we do it a bit more meaningfully in the future. So I hope that provides you with a little bit of reassurance.
Yeah, great. No, thank you.
Thank you. And Councillor Allgood.
Yes, thank you, Chair. Several parts to this. I think Ms. Gould has covered a few things I was going to say. I think the job of this committee would be to actually give the steer of whether we want customer satisfaction or whether we want them to do it as fast as possible. So it's okay looking at setting up KPIs and saying we want the highest possible, blah, 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 etc. But actually, you can't do one. You've got to do one or the other. And I think it's probably important that this group suggest which way you want it to go forward. I'm not saying you abandon the speed you do it, but you give a priority to say, actually, we want a great customer satisfaction will be our ideal, and if that means it to the cost of waiting longer, then so be it. That's my first point. I think I'm slightly confused because all of this talks about performance over the last 12 months and only gives 3 quarters. There should be a 4th quarter, unless I've done my maths wrong. The fact that Cyrus now gives allows you to do KPIs or indicators that are much more accurate because that's what it was built to do. It's no good looking at the previous quarters because we're using a different system, and you can see that they've dropped, and it may be because there's a learning process and stuff like that. But you might as well throw them out the window and say, look, under the new system, this is how we want to do it, because otherwise it looks as if we've gone dramatically wrong. And if we're comparing ourselves to other districts, then they will just look at our figures because they don't get the instruction saying this is why it's gone lower. They'll just go, oh, they've dropped, so there's that comparison. So I think for me, we give the steer, or the committee gives us a steer of which way you want them to go. I think with KPIs, which I'm not a fan of, I think it's a case of doing the best you can, full stop, end of. Because we can all look at KPIs and say, this year it was great, but there was a reason for it, and last year it wasn't as good, but there was a reason for it, and we just move on. So you need to be sort of aiming for as good as you can get. And if you can use KPIs to justify the result, then so be it. Thank you.
Some really useful points there. Councillor Allgood, did you want to come back, Mrs Scott?
Thank you, Councillor Allgood. Just to touch on the Q4, quarter 4, as we're in that quarter, we haven't gathered that data just yet. So quite right, it does say the past 12 months, but I guess it's in the current 12 months. Maybe that should be rebranded. So I take that on board. Yeah, I agree, and I welcome to understand what Scrutiny would want to see that customer service offering looking like. Like you said, is it about the right service? I don't want to say at the detriment of wait times, but how do we do good service and manage call wait times and what have you? So again, welcome that input and what that looks like, and it can help shape how we move forward. So yes, thank you. And I guess I think, was that all the points? I think it was one more point. Was that all the points? Brilliant, just want to make sure. Thank you.
Thank you. So Councillor Allgood, what would you suggest as the way forward?
Well, on behalf of, personally, I think it's customer satisfaction is the key. I think you'll find that most people are used to waiting. I know that the Cyrus system will allow a callback, which is definitely beneficial. So it will give you the option, if you don't want to wait, give us your number, and that can alleviate a lot of the call waiting. So therefore, for me, priority would if we're going to do it, let's do it right and make sure that people are happy with what we've got. Because some people are just never going to be satisfied. Let's accept that. So the ones that we can influence, that's what we should be doing. Thank you.
Thank you. Councillor McCann?
I think just based on Councillor Allgood's very good point there, I think, so for Ms Scott's benefit, obviously you're the manager of the team. What is the benefit of conducting these surveys with members of the public, calling your team? It's about performance managing your team, isn't it? There's that element of it. You want to make sure your team are doing a good job and they're hitting their performance indicators. And that is entirely separate to, did that person get that bin collected that was late? So I think it's more about, just what Jenny mentioned really. I think it's just thinking a little bit more around what is, it's almost like being able to measure everything but not understanding the value of anything. We can have spreadsheets saying, with all this data, that actually doesn't take us any further forward. So is it a case of actually shunting the customer satisfaction piece to the respective units that's not your unit in terms of being front of house and focusing on, a success for your unit is the speed at which calls are handled and then referred to the respective organs of the council to get managed. It's not the overall customer satisfaction piece, is it? I think that it needs to be there, but it probably should be shunted to the respective units because they're the ones ultimately delivering, aren't they? So that would be my sense of it.
Thank you for those comments. Mrs. Gould?
Yes, if I could just address that point of Councillor McCann's chair. I think you're right, and there is customer satisfaction type monitoring that already goes on within services. So, for example, housing has to, with effect from April, has to report on tenancy satisfaction measures, and there's a whole kind of raft of questions that are mandated, so that we don't get to influence what those are. And they'll be published alongside everybody else's, so we'll be able to see where we are in a sort of league table type approach. So you're right. I think for me, when I'm thinking about our sort of customer service and the transformation that we need to do to improve services as a whole, I am thinking about it in terms of that first port of call, but I'm also thinking about it from a council-wide perspective. And although there will be different types of monitoring around performance that can go on within services, actually when somebody phones up their council, that's what they're doing, and they're not necessarily thinking in individual departments, and probably nor should we. We want to give an inclusive and comprehensive response to a customer that is seamless, really. They don't, you know, it's not, the customer shouldn't feel like they're being passed from one to another. That may happen in the background in order to get the right resolution, but that sort of customer journey should be seamless. So I think we need to have a think about what that looks like and how we achieve that. As we move through our sort of improvement journey, I think it'd be really helpful for us as officers to bring it back to scrutiny, to kind of test our thinking, get your views on, you know, what is the type of customer service that you want? Do we want to, for example, think about a more digitally based customer service where we can, so that we can free up resource to then help the most vulnerable within our communities? Do we want to answer the phone within 10 seconds and encourage that type of contact and that type of behaviour? Or do we want something else? And I think these are the journeys that we need to go on, and we need to think that through and to come back and test that out with scrutiny. So I think, you know, what I think is helpful from an officer point of view is if we bring this back in the next municipal year in a few months' time, when we're a bit further on, and we can kind of share some thinking at that point and get a real steer from scrutiny as to what that strategic direction should look like before we take anything on further to Cabinet, for example, for agreement.
Thank you. I think that's a sensible way forward. I think the officers present have taken on board the comments of the committee and a steer from the committee as to how we think we should proceed. Are we happy for a draft of some KPIs to come back to this committee in the new... Sorry, yeah. Sorry, Tracy, do you just want to reiterate your proposal again? Sorry.
Yeah, of course, yeah. So my proposal is with regards to, do you want the slide back up just to see it, or just move to verbalise it?
It's in the report, but just,
okay,
yeah,
that's fine.
So
yeah, the proposal is for the removal of the customer satisfaction KPI and in place to put in the customer answer rate, so we can understand that we're getting to X amount of customers, and of those X amount of customers we are doing first point resolution on a certain amount of calls, and then retaining the complaint corporate-wide KPI with regards to corporate complaints.
How does that sound? Yep, we're in agreement? Okay. Thank you very much. Can I just say, sorry, I know this is the first time that you've presented to a council committee. The presentation was good, but your response to the questions were brilliant. Thank you.
Thank you.
So you got 100% customer satisfaction there. Okay, so the final item on tonight's agenda is our dates of future meetings, and it's just to note that the next... Yes, please. So your microphone, please, Mr. Mosh.
Yeah, the regulator of social housing are introducing new consumer standards from the April the 1st, which obviously will affect the council.
Thank you. So the final item on tonight's agenda are dates of future meetings, and it's just to note that the next Community Scrutiny Committee meeting will be held on 19th of March at 7 p.m. Just before closing, can I just thank the members that offered to substitute for the other committee members this evening. So thank you for giving up your time and your contributions this evening. So at 9:09, I close tonight's meeting.